Michael Dowling is the president and CEO of Northwell Health, the largest healthcare provider in New York State. He joins us this morning.
The issue becomes each and every day making sure that you have the right staff with the right skill levels. We're well prepared at the moment, and we will be well prepared no matter when that apex comes.
This is one of the most sophisticated labs in the United States.
They are among the first in the nation to get approval to partially automate the testing process for COVID-19.
We're ICU doctors. We're used to pressure. We're used to seeing a lot of things that normal people don't see. But this is really beyond anything I've seen in my career.
It's very scary and very real, but the camaraderie that I've seen, I've never seen before.
And it was quite a welcome sight. 46 traveling nurses were greeted by cheers this week as they arrived for training sessions here.
The number of patients coming in each day is being decreasing, and the number of people we're discharging is increasing. That's a good sign.
We were told that over the last 72 hours, they have actually discharged more coronavirus patients than they've admitted.
Thank you, everybody.
Eurena Soriano was in her third trimester when she developed COVID-19 pneumonia. She was placed on a ventilator. Yesterday, this moment, her husband put that baby boy in her arms for the very first time.
People leaving the hospital every day. More and more of them leaving today than ever before.
Every day I just feel this gratitude towards my family and friends, and especially towards the staff.
I'm eternally grateful to everyone at Northwell, all the doctors, all the nurses.
For 1 hour, firefighters stood in formation, applauding the hospital workers during their shift change.
It feels great having the support. This is awesome. Amazing, amazing, amazing.
The healthcare system is resilient. We will handle this. You don't quit. You don't retreat. You don't put up the white flag. You are going to win.
Good morning, everyone. I am David Battinelli, Chief Medical Officer here at Northwell Health. Unfortunately, our President and CEO, Mr. Michael Dowling, is feeling a bit under the weather and will not be able to join us today. We do, however, have him on the line to say a few brief words.
Hello, everybody. This is Mike Dowling. I'm the President and the CEO of Northwell Health, and I want to welcome all of you to our third Constellation Forum. And the first, due to current circumstances, being done virtually. Unfortunately, I won't be able to participate during the meeting. I am under the weather, as you can probably tell by my voice, the result of a pretty nasty bug. Fortunately, of course, it is not COVID. We are all going through a unique, once-in-a-lifetime experience, which inevitably will change us all and our organizations. This gathering will discuss those changes and the future new normal. At Northwell, we were at the epicenter of coronavirus. We treated over 70,000 COVID patients, including 17,000 inpatients. That was an experience which we have recounted in a book just released. And the book title is Leading Through a Pandemic, the inside story of humanity, innovation, and lessons learned during the COVID crisis. You may find it interesting reading. So my best to all of you for being with us, and hopefully you will have a substantive and enjoyable few hours. Again, thank you, and my apologies for not being able to be with you for the remainder of the session. Thank you, sir, very, very, very much.
Thanks, Michael. We all hope you're on the mend. On behalf of Mike Dowling and all of us at Northwell Health, thank you all for joining us today. And a special thanks to all the staff and everyone who made the Constellation Forum possible, despite the circumstances of what I guess many of us call our new normal. Each year, this event has surfaced new ideas and spotlighted the innovations that are advancing healthcare. Today, over 1,200 of us have gathered virtually, and we are focusing this conference on COVID-19 and the resulting impacts we have all felt and the remarkable efforts that are helping lead us forward and hopefully out of it. In a few minutes, you will hear from the nation's leading voices in science, technology, and healthcare, each who have guided their organizations with great diligence and forward thinking. During the past few months, we've seen more focus and ingenuity through this crisis than I can remember for such a short time frame. This novel coronavirus has been an impenetrable force, sweeping through New York, through Northwell Health, and is now making its way through communities and cities across the U.S. and beyond. It simply has no bounds. What we have learned from it has been a new sense of spirit that has joined us together for a common goal to beat the novel coronavirus. Speaking for Northwell, our health system endured quite possibly the worst of COVID, having treated more than 70,000 patients, the most of any other provider. That's remarkable, considering it was a 3-month period where our facilities were overloaded, operations were overwhelmed, and most importantly, our employees stressed. This has been a burden on our employees like they had never experienced before. Enormous challenges emerge daily, sometimes hourly, especially for those on the front lines who were learning and adapting in real time. Our team has demonstrated extraordinary resilience, fighting as one to support each other and save as many lives as possible. We are all extremely proud of their efforts and how they responded seemingly without fear and with remarkable courage. What's happening across the U.S. is frightening because we know there were lessons learned here in New York that were not taken into account. Important lessons that may have prevented outbreaks currently being experienced in the South and West. We're lucky to be in the situation we're in, seemingly past this first wave. But we cannot relent. We must be prepared for possible future waves so they don't crash as hard. One of my favorite authors, Ernest Hemingway, once said, "Courage is grace under pressure." And to me, we have the most graceful team around. Our team did not run away from the fire, but rather they ran toward it, sometimes sacrificing their families and own lives. And later in today's program, you will hear a personal experience from one of our amazing EMS leaders who entered the fight. This is the heart of a caregiver. It is what they do. It is so humbling to be around them and feel the strength and commitment they carry day in and day out. Many of our achievements during this crisis revolved around persistence and creativity. To avoid a potential shortage, our innovative researchers and clinicians created a way to transform sleep apnea machines into ventilators. That same resourcefulness was shown by 3D printing nasal swabs in response to critical shortages and the relentless onslaught of necessary COVID tests. As our inpatient hospital capacity wore thin, our administrators and operations staff worked to create almost 200 beds a day, over 2,000 beds across our entire health system, an extraordinary feat that would typically take months, if not years, had we not been forced to find a solution. It is just that productivity and spirit that we must preserve and nurture moving forward. Make no mistake, we all want to return to normalcy, and we will at some point. But we must seize this unique opportunity and do the right thing. We must learn from our experiences and rise to the challenge to build a better tomorrow. Our future solutions to healthcare's challenges lay in collaborating across boundaries, partnering in unique ways that unlock the inherent value across our domains. We will be stronger because of this, and having conversations like you will hear today is a big step in the right direction. Again, let me finish by thanking everyone for attending. I hope you enjoyed the program today. On behalf of everyone at Northwell, we hope you stay well.